we have this chain crusty. So this is the ancillary supplies here. Okay. Vaccine is in there.
I think everyone in my department as well as this hospital is excited that the vaccine's here so we can finally immunize all our employees and make sure that we can ensure their safety as they take care of our patients who are extremely vulnerable.
It was exciting. We got our vaccines delivered last night from the Oak Park Police and the Village, so we are excited to be administering our first vaccine this morning at 6 a.m. The thing that's kept me up at night throughout the pandemic has really been our staff who have gotten sick. And to think that we've now gotten to a point that maybe our staff won't get sick anymore really gives me a sense of calm.
There's this one, and then there's a general green
Hi, how are you?
Good, how are you?
Excellent. Right, today has been a long day coming for a lot of reasons, and so I'm excited. I'm honored to be chosen as one of the first to get the vaccine. It feels empowering to be able to get this vaccine today because in March we didn't know what we were doing. The one thing that I would tell skeptics, right, is to trust the science. I trust the science behind the vaccine. I think it's safe. I trust the physicians who are recommending the vaccine.
Can't see, but I got a big smile on my face.
Most importantly, a couple of side effects is nothing compared to the damage that the coronavirus has caused. I've had to hold the hands of patients because their family couldn't be there to hold their hand while they're dying. I had to try to revive multiple people in their 30s and 40s when this pandemic first started.
All right, ready?
Ready?
1, 2, 3. Sorry. You're good. Oh, I put one on you for fun.
Yeah. What a good day.
I think it's exciting as well as encouraging. I think it's one step for getting us back to normal here. So I'm just very excited and happy I can be one of the first. Well, I would say to members of the Black community, it's definitely okay to be cautious, especially considering the Tuskegee experiment, Henrietta Lacks. You know, it's not wrong for them to be a little cautious, but I would encourage them to talk to a healthcare provider that looks like them, ask them how they feel about it, ask them did they receive it, and, you know, to take, I guess, more control of their own healthcare. I would encourage them to just, you know, have faith, talk, read more, and, you know, look at the data. There we go. Okay, not that bad.
I told you.
Not that bad.
10 out of 10. Highly recommend.
Well done.
Well done.
My bandage for her.
Yeah. Feels good. Feels actually really good. There's quite a few family members that do not want to be the first to get the vaccine. You know, they don't want to be anybody's guinea pig, but I always think about the adverse effects of having COVID versus the adverse effects of having a vaccine, and I'll take life over death anytime.
If you can go and sit in chair number 10 for about 15 minutes, and then you're all set to go, okay?